Jocelyn, I just wanted to ask about the statistics, which I thought were quite amazing, and also the fact that the number of, like, 62%, you were saying, women have got acquired brain injury. Is there actual a link? And I wasn't quite sure about that when we were looking at your talk about causality and the link between the brain injury and the crime itself, and that's why they were there, and whether that was taken into consideration as part of the sort of judicial process, or was that just outside of the scope of what you were doing, really?
Brain injury isn't screened for nor recognised kind of at any part of the criminal justice process as standard. So many of the women that we worked with had no contact or understanding of their brain injury prior to meeting the link worker within prison. We are doing some work currently with Devon and Cornwall Police and hopefully South Wales Police to enable them or support them to understand how they could screen or increase their understanding of brain injury within the forces. So actually the issue of brain injury is not considered unless it's been kind of specifically diagnosed, which for many of the women it hasn't. And in terms of causality, I think that whilst we're not here to suggest that for those female offenders, kind of brain injury is the sole or ultimate cause, I think many of the women that we worked with were repeat offenders. There were women, I struggle with that word, offenders, but there were women who had been in and out of prison 5 or more times. And many were being recalled for breaches of licence conditions or for not complying with certain regulations that were put before them. And actually their understanding of those licence conditions, their ability to comply due to their impaired memory function, due to their impaired cognitive function, was reduced because of their brain injury. And our work within the prison, we worked with one woman who had been recalled 12 times due to not complying with her licence condition. And we worked with her to rewrite her licence condition and work to improve the understanding of the probation officer that she had a brain injury and a way in which we could support her to engage with her appointments. And at our last contact, she'd been out of prison for the longest period of time she'd ever been out of prison since her original offence. So when we're talking about adaptations for brain injury, we're talking about some very simple things that can change women's experience and engagement within the criminal justice system.
I've got another question that's come through online, which is, are there any organisations who are providing information for women to identify their symptoms? And are there organisation websites that can help identify symptoms of brain injury? In criminal law, I found many women and men with brain injuries identified by brain mapping scans also had learning difficulties.
Yeah, I think so. The government, the previous Lord Chancellor Robert Buckland requested for there to be a review on neurodiversity conducted by the inspectorates, the HMPPS inspectorates, who have looked at neurodiversity as a whole, so across kind of autism and learning disabilities and brain injury. And I think we find that there are kind of similarities in terms of individuals' needs, but also often that you're talking about a kind of similar group. Although we do see, the research does suggest we see far higher numbers of people, men and women with brain injury in the criminal justice system than other neurodiverse conditions. In terms of information and advice, due to the fact that there's limited screening and training for professionals around brain injury, there's a limited amount of resources out there for women who are touching the criminal justice system on brain injury. We have just secured an agreement with HMPPS and NHS England, where we'll be rolling out our basic understanding training to over 60,000 prison and probation officers, so that they can understand what a brain injury is, what it looks like, and what it might be looking like to them in their interactions and engagements with men and women within the criminal justice system. But we need to make sure that that training comes to life in practice, and that if we do implement screening, we have the so what question is answered. We understand how we will change our practice, our interactions and engagements to improve the responses that we give women with a brain injury. You can find some information on our website, so please do go and have a look. But also, just to point about the brain injury scan, many people think that when we're talking about brain injury screening that we're talking about kind of wheeling in scanners into prisons, and that's not what we're talking about. We have a clinically validated brain injury screening tool, which is 11 simple questions, which enables you to understand with some reliability the history indicative of a brain injury and the severity of that brain injury. And there are many other tools out there like that.
Thank you. Oh, hello, at the back.
Thank you. Hi there. A question for Maria, but thank you to all of the panellists this morning or this afternoon. Maria, I just wondered what your take on the impact of the pandemic is in terms of where it might leave maternity systems or hospital trusts' engagement with human rights in maternity care in the longer term. Has it increased their acknowledgement of the rights conversation, or has it problematised that?
Can you hear me? Is that right? Okay. Thank you for that question. It's a really good question. I mean, I think there are some positives to come out of COVID, because I think we've all seen that kind of that balancing question play out on the news every night, haven't we? About, you know, how do we make the choices between how we control the virus, but what does that mean for people, and are those restrictions too onerous, and what are the consequences of that? And I think that's highlighted the need to have those conversations and to be aware of the consequences of, you know, and the fact that you can't just have one simple goal of controlling coronavirus. There's got to be some consideration of other factors as well. But I think what is going to be a risk to human rights in maternity care and applying to maternity services is this staffing issue, and the fact that services are under so much pressure. And I think that really reduces the capacity of people to think about anything else but staffing the next shift. And I think a lot of trusts are in that situation at the moment. And I think at the same time, what we hear from midwives and healthcare professionals is that there's this rolling barrage of kind of press about scandals at different maternity services, which are all very valid and things that we should absolutely look into and learn the lessons from. But I think people are feeling, oh, we need to do this, and we've got to do this, and we've got to implement this, and they just feel overwhelmed with dealing with all of that, and also dealing with their day-to-day job. And I think that's where the pressures are and the risks are at the moment. I think we need an urgent focus on retaining midwives and making sure that they feel valued, and that they're given flexibility and paid breaks and bursaries and all those things that kind of adds to people feeling that they're doing a good job and that society values them, and also a focus on more investment for the longer term and better staffing levels going forward.
Couldn't agree more. And obviously my favourite topic, Brexit. You know, we've got midwives leaving. It's tragic, and I know that, you know, it's very hard for, you know, when we get our clients that they're worried about actually having, you know, a safe birth, and that's just unacceptable, I think. Have we got any other questions in the audience? Hi, Charlotte.
This is also to Maria, just that you were touching on some of the good practice that you've seen during COVID. So I thought I'd ask a question about, you know, some of the good things that are happening. Is there anything that's sort of come out through COVID that might last a bit more longer term? potentially maybe going back to the question about looking at rights, but is there any practice that has come up, maybe giving more support to birthing at home and things like that, that going forward could be better? Because I know some areas of medicine have found more flexible ways of working. Maternity services do seem a bit different, though.
Yeah. Are there positives coming out of it? I think there were definitely trusts that did some really good stuff, and I think that came down to having really good leaders in place in a lot of places, and embedded ways of working where there was already an emphasis on continuity of care and midwifery-led services, and those were already kind of business as normal. I think in places where those practices weren't well established, they were kind of pulled quite quickly. Hopefully, there's a lot of research being done on COVID, on the impact and on the maternity experiences of women, and I hope that research will add to our knowledge. I think there's been a lot of research, for example, on the impact of telephone or teleservices, and there's good and bad in that. Some people have found that really convenient. In other places, I think it's that things have gone under the radar that shouldn't have gone under the radar. But it's been an opportunity to experiment and to sort of look at new ways of working and to ascertain whether some of those could be kept in future. So I think those are good things. I can't remember what the rest of your question was. Sorry, Michael.
I think you've mostly answered it, but it was just sort of about new ways of being more flexible and trying out different ways of practicing. Yeah, but I think you've sort of answered most of it.
Thank you. I think another thing that's just come out as well is that it's the small things that make a difference. Like what people have said is that it was somebody who came in and held their hand or looked them in the eyes, and I think we all get focused on the fact that we need more staff and those bigger issues, but to women and to people who were in the service, it was just somebody who took a bit of time to say something kind or to hold somebody's hand or to, to be with them when they needed them. And those things make such a massive difference, and I think we need to hold on to those as well.
I just wanted to say thank you, Ernest, for coming and talking to us. Many of us followed the news of Mary's death on social media and in the newspapers, and it's a real privilege to hear you speak. And thank you for your dignity and courage, and for campaigning for all women and for black women and Asian women and minority ethnic women in particular, who we know have a less good experience of healthcare services and maternity services. We all really appreciate what you're doing. Thank you.
On that note, do you want to say anything? Okay. No, sorry. Ernest wants to ask a question. I'm not allowing the panel to actually ask a question.
Yeah. Thank you very much, and thank you for your encouragement and kind words. I just want to find out from Maria. I know a lot of people out there are ignorant about their rights when it comes to childbirth. Even their birth, a lot of women out there are also ignorant about their right in health. For me, I was also very naive. I didn't know anything about whether there is a right for your health, even during pregnancy, during birth. How do we get this message across? How do we get everybody to know their rights when it comes to childbirth? Thank you.
Good question.
Thanks, Ernest. And then just to echo Mary's comments, it's so we're privileged to have you here and to listen to you speak as well after all you've gone through. So thank you. I think that's a really good question about how we get the message out to women. I think obviously the challenge is that the population of pregnant women in particular kind of turns over every year. So as an organisation, we've often chosen to focus on healthcare professionals because they're the stable kind of bit of the system, and if they change their practice, we hope that feeds through. But I think increasingly we're starting to look at, but how do we get the message out to women directly? I think that's a system-wide issue. I think there's some good work going on. For example, we're involved in a project with NHS England called I Decide, and it's a two-way consent tool. And the idea of that is that it gets introduced in the antenatal period so that women understand right from the outset that they have a right to make those decisions for themselves, that they have a right to receive information that's evidence-based, they have a right to have a discussion about all of the options that are open to them, and that in the end it's their decision and not the healthcare professional's decision. I think that's a real culture change that needs to happen. I think there's also personalised care and support planning guidance being introduced, and hopefully that will also help to make that change. As a charity, we have fact sheets, and we have our advice service for anybody who wants to contact us, but we're also aware that we're a small part of the picture, but we're trying to contribute to the bigger change as well. But I think it's a really important question and something we all need to focus on. Thank you.
Well, on that note, I think we all want a cup of tea now. We're going to take a break, and then we're going to come back with some other absolutely brilliant speakers. So for the Hoppers 3, yes, Rupi.
One more question online.
Oh, I'm so sorry. Sorry, one more question online. Apologies. Regarding issues relating to maternity care, these issues very much remain within the postnatal period in the community. A report has been released this week regarding the lack of support for new parents, particularly need for funding for local authority and health visiting services. There continues to be a great disparity between areas relating to home visiting face-to-face contact with these services. Parents and mothers specifically continue to be restricted to specialist services, including breastfeeding support, postnatal mental health support. Be it the Institute of Health Visiting and First 1001 Days continue to raise awareness of the need of additional funding for resources. And I think we probably echo that, especially postnatal, psychiatric help as well.
Yeah, absolutely. We've heard those stories, lots of accounts of people saying that it's the period afterwards when they go home where they particularly feel that they've got no support. They've got often seeing a health visitor online, where it's sometimes difficult to build up that same rapport where you feel able to disclose how you're feeling. And Mary might want to say a bit more about this area and postnatal care, but I definitely would echo calls for greater investment in those services. They're often a forgotten kind of really important help and support for new parents, aren't they?
Thanks, Maria. I'm Mary Newburn and have been, my eldest child's 44 now, and I've been knocking about in maternity pretty much ever since, trying to improve things, and I completely take my hat off to the current generation of influencers and Maria in particular, who's demonstrated today such knowledge, skill and passion. I think postnatal care is so frequently overlooked, and yet even things as serious as deaths tend to happen actually after birth, and in the days and weeks and even months after birth. And yet because it's very spread out, and because there isn't very good connection and continuity between the data in the community with intrapartum data or birth records, we very often aren't aware of those long-term consequences. And I've just mentioned deaths, which of course are the extreme end of adverse outcomes, or one of the extreme consequences. But there are many, many thousands of women and families that suffer because people aren't getting the support that they need, social support, emotional support, help with that transition to be a mother, be a father, and the massive change that entails. And people are at home alone so much of the time. And as we have acknowledged increasingly, it's a 24/7 job, and we don't prepare people for it because it's a biological thing that we become parents. There is just an assumption in our modern society that people can just get on and do it. Whereas in many previous societies, there's been a huge amount of familial and village support for that role. And the COVID pandemic has made people even more isolated and vulnerable. And we do need both good health visiting services, good postnatal midwifery services up to at least 10 days or 28 days after birth. And also the voluntary sector is very often overlooked and yet provides a huge amount of the specialist support with breastfeeding and mental health and so on. So yeah, it's great that that speaker's raised that issue. Thank you.
Okay, I think we'll have a cup of tea. Thanks to our brilliant speakers.